Benzos were first made available in the 1960s and were initially welcomed by medical professionals. However, by the 1980s, the risk of dependence had become obvious, and a lot of protocols are in place now to ensure that risk is reduced. If patients, however, do become dependent, they are entered into a withdrawal program. Our project is on the issue of benzodiazepine use within London. The aim of this project is to raise awareness about the consequences of improper benzo use and how healthcare professionals can work together to overcome this issue. Deaths related to drug misuse are at the highest level since 1993. In 2015, there were over 8,000 hospital admissions and over 400 deaths specifically due to benzodiazepine use. The number of long-term users of benzodiazepines or benzos are alarming, and the figure stands at 300,000 currently. But what are benzodiazepines? Benzos are psychoactive drugs which are mainly used for the management of anxiety and insomnia. They are prescribed for no more than 4 weeks due to the dangers of falling dependent. The symptoms that will be brought about by sudden withdrawal of the drug include seizures, psychosis, recurrent anxiety, insomnia, and depression.
We interviewed the Barristers Project and Turning Point, who are organisations that provide support for those dealing with drug and alcohol addictions. We also work with Jo, the practice manager of Greenwich Peninsula and Clover Health. A patient suffering with benzo addictions, amongst other conditions, was kind enough to let us interview her.
So, if we start from the beginning, if you're comfortable with that.
When I was 15, what happened was I got in bad company. I got addicted to heroin. When I was 16, I was arrested for selling it. And I spent 8 years in prison for it. It didn't take me long to realise that in prison, you either hold your ground or you go under. And I was always very aggressive by nature. I still can be. In prison, they got the doctor, he injected me with something. Next thing I know, it's the next day. Basically, they just wanted me as helpless and as quiet as possible.
Huge numbers of our patients start on these dependent drugs in prisons. So you will find the pregabalins and the gabapentins, all of that stuff starts in prison because somebody presents to prison and it's easier to just sedate this person and put them in a cell than it is to actually try and treat them for the mental illness. You might not have the ability or the access to mental health services to treat them. So you treat them symptomatically with the benzos, and then when they get discharged, they're now discharged on benzos, but the GP then continues, and then it becomes a problem. So it's a very complex issue in prisons. It's a lot better than it used to be because clearly a lot of prison healthcare systems will not prescribe very liberally, and certainly the prisons where we operate, we have noticed a rationalisation in the amount of benzos that are prescribed.
Were you diagnosed with depression?
Yeah,
When was
manic
that?
depression.
Manic depression. Do you remember when you got diagnosed with that?
Yeah, when I was 18.
18. So whilst you were in prison, did you come to them saying you felt a certain way? Or was it them that...
Violence.
Violence, okay.
When I finally got out of jail, I'm still on all this medication.
Because you've been... When did it start becoming a routine? Like, did they start giving it to you every day?
Yeah.
Just all the time throughout?
From the get-go. From the get-go, there was never no suggestion until Jo and the people she works for, until they took over, I think it was last October, there was never no suggestion made by anyone to cut me down on anything.
So that gap is how long? 40 years?
41 years.
41 years. So then between 23 and where you are now, did the prescriptions increase in size, or were you on the same level of all of them?
Up.
Up.
Only ever went up.
And what were the reasons? Do you know?
Yeah, because I used to ask for them.
You used to ask for them to increase?
Yeah, plus I was buying them on the street. But I always told my different GPs over the years, I said, I need more. They went, we can't give you no more. I went, sweet, I'll go and buy them of someone else,
Yeah.
which I did.
People with benzodiazepines are very often seeking those benzodiazepines for mental health issues. They then become dependent on them, and they then end up with the dual diagnosis of the anxiety disorder or whatever it might have been that made them seek out the benzodiazepines or got them prescribed them in the first place, as well as now an iatrogenic dependency on the benzodiazepines that they've been prescribed. Patients can then drift quite rapidly into non-prescribed benzodiazepines, because very often the long-term supply of benzodiazepines from the GP is disrupted. So they might not see their usual GP. The GP surgery might decide they need to cut back on their benzodiazepine prescribing. So suddenly that patient's benzos might stop, and they then have to get them elsewhere. And of course, the advent of the internet has made it all that so much easier for people to get hold of benzos now.
I mean, when they're buying it online, they have no guarantee what it actually is.
None at all.
Yeah.
None at all. You know, it's unregulated manufacturers, and of course, we're in the age of information now. So, you know, you can find the formulas for these medications anywhere, and anybody with half a chemistry degree can knock them up, but not with the quality control and, you know, safety measures that a huge pharmaceutical company would use.
I don't know if you've heard of the Beresford project.
We looked at it. You've been in contact with them a few times, haven't you?
I've been with them for years.
Yeah. They do good work.
Yeah, they're brilliant.
So when did you first get in contact with them?
Who, the Beresford?
Yes.
When they first opened 30 years ago. In them days, if you wanted to go into detox, they told you straight, you're looking at a 6-month wait.
Really?
Yeah. All they wanted to do was give you basically clean needles and things like that. They weren't much help.
So that's why you didn't want to go back?
Yeah.
But then
Past experience.
Once you went, it was alright?
Yeah. I was lucky. I got another brilliant key worker, Mark.
So how often do you see him?
Every other week.
Every other week. And that's been the same for years now?
Yeah.
Yeah. And what sort of things does he do with you to tackle? Talk. Yeah.
But they can help you with everything. From benefits to housing,
Okay.
legal problems, anything and everything.
We had the opportunity to visit the Beresford Project and ask them a few questions about the support that they offer people suffering with drug and alcohol addiction.
How long do you reckon you would see a patient for? How long do they often stay in contact with you? Is it lifelong, or do they come in?
We try to sort of time limit it and, work towards goals of time. But with the drug clients, they might have a longer stay with us because, they'll be on a maintenance prescription, which will cause them to, keep coming in. And sometimes, because our clients are very complex, it's quite hard to encourage them to detox or to cut down. It's a slow process, so they would be in treatment with us longer. We give them several chances, and then we would have to close them temporarily, but they can always be rereferred.
I was going to ask, do you find you lose contact with people and then they come back after a period of time? Is that common?
They do. They quite often disappear for lots of reasons. They might go to live in another area, they might go to prison, you might not know about it.
Even though I used to take everything I could get my hands on to knock myself out at night, at the same time I used to dread going to sleep because I didn't want to wake. I thought with my luck I'll wake up again tomorrow to another day of this. It was just soul destroying.
What do you think got you through?
The support from my mum and Vicky, my friends, Dr. Garel, Joe.
Yeah.
Even Lynn, one of the receptionists.
Yeah.
My key worker at the Beresford. I'm lucky, I've got a very good support network.
Yeah.
When I first met Joe, I thought, oh Christ, I've met my nemesis. I did, I really did. I thought this woman is going to be trouble. She's going to be hard work. But she's been fantastic.
Yeah.
Absolutely fantastic.
So what advice would you give to medical students training at the moment in terms of not just benzos but prescribing in mental illness and how to deal with drug addiction?
I think that you need to prescribe appropriately for whatever mental illness you are treating, and you need to be honest with yourself and your patient about whether you are prescribing for their symptoms or for their illness. So prescribing benzodiazepines as an adjunct to an agitated, depressed state, for short-term use, whilst the antidepressants kick in, you need to really educate the service user or your patient around the fact that these benzodiazepines may well stop or are going to stop in 3 days, and you will try different alternatives for sleeplessness, and that they cannot expect a long-term use of benzos. It's off license and you're not prepared to do it. You also have to ensure that within your GP practice, if that's where you are, that there is continuity of care and you don't have a different doctor seeing patients different times and just continuing what the last doctor did. And, not to be afraid of using medication. Medication's incredibly effective, but to have a very good concept of what that medication means for the service user. So it's about having a professional curiosity into what is actually happening for that patient and their medication. But certainly benzos long term is something that I wouldn't do without specialist input.
So what would your advice be to those, because there are a lot of people who say are in the same position with you in terms of the benzos, but they're not compliant, they don't want to stop, and they don't listen to the doctor.
Yeah,
What advice would you give to doctors handling that? Like, what is a good approach? They're frightened.
Yeah, they're frightened because you can fit and everything. It's not nice. They're scared, that's all. Just don't try and take them off at breakneck speed. Do it like the Beresford say. Like, there's guidelines, obviously. I'd say do it that way.
To just give them support so they don't feel as scared.
Yeah, because that's what it is. They're frightened.
Yeah.
How would you describe yourself after stopping the medication that you were on? Like, what has changed?
Everything. I now feel like I've got a life, not just an existence. I can now see possibilities that I would never have dreamed of before. My daughter went to Dubai 12 times last year. She loves it out there.
Wow, that's
She
a lot.
goes at every opportunity. She'll go for a long weekend.
Seriously?
Yeah.
Wow.
And I want to go with her.
Yeah.
You know, I want to go to a lot of places with her. And I've just never had the energy before because of all the pills. You can make a bad choice, it don't necessarily make you a bad person.
Yeah.
Good people can make bad choices. I made bad choices and I've paid for